8:12 on this Thursday morning, March 14th, Pi Day for some, the day before the Ides of March, and of course we're counting down towards St. Patrick's Day. March is also National Kidney Month. Taking care of your kidneys is an essential part of staying healthy. Our friend Dr. Brent Wallis, Chief Medical Officer of People's Health, joins us to talk about our kidneys and how to keep them healthy. How you doing, Dr. B?
Hey, Tommy. I'm doing great. How are you?
Good. You wearing green today?
I am today for the next couple of days,
there
actually.
You go. You always want to be safe. You don't want to get pinched, right?
Absolutely.
Actually, in today's climate, I wouldn't pinch anybody, just to be clear. Tell me about our kidneys. What do they do?
Yeah, sure. So some people don't know all of this stuff, but almost everybody has two kidneys, and they're about the size of a fist, and they're not located in your abdomen, which is what a lot of people think. They're actually below the ribs on either side of your spine, so they're actually on your backside. And really the main job of the kidneys is to filter blood, and they work really hard to remove all of the waste, toxins, and even excess fluid from your body all throughout the day. But then they have a couple of other functions. They actually help control your blood pressure, and they help send a signal that helps you to create red blood cells that are very important to get oxygen around your body. So they're two very hard-working small organs.
How small are they? How big is a kidney in a human being?
Yeah, they're real tiny. They're about the size of a fist. And, so, maybe a softball is another good comparison.
Yeah, I heard you say that, but it's hard to believe. You always think of kidneys being like the size of lungs, but they're not.
Yeah, no, they're much smaller.
Wow. How do they filter blood?
So what they do, and they do this really all throughout the day, what happens is blood enters the kidneys from the heart. So the heart pumps all that blood into the kidneys, and it passes through these tiny filters. There's millions and millions of them in the kidney. They're called nephrons. And what those nephrons do is they remove all those waste materials that are in your blood, and then they return the cleaned blood into your bloodstream so it can be used to do everything that it does. And those waste materials pass out a different route. They actually go down into the bladder, and that's how you create and store urine. And they do this actually about 60 times a day. They filter your entire body blood volume. So that's about 200 quarts of fluid every day. That's enough to fill a large bathtub.
That's a lot of work for two things the size of your fist.
Exactly. They're very hardworking organs, like I said.
What are some common concerns for kidneys?
There's a few things that happen with the kidneys, and one a lot of people immediately think about is kidney stones because they can be very painful, and they are pretty common. About 1 in 10 Americans will get a kidney stone in their lifetime. And what that is it's actually when all those waste materials are being produced, it's got a lot of things like salt and chemicals that are extracted from your blood, and they can clump together and create a little hard mass of minerals, which essentially looks like a stone. Now, it's very small. Sometimes you can't even see them with the naked eye. But, when you're properly hydrated, usually that just gets flushed out your system and it leaves your body through the urine. If you don't have enough fluid, then sometimes it will bind together and form that stone. And that can be extremely painful, especially when they're moving through the system and then when they're trying to get out of your body. Usually stones don't cause a ton of serious health complications as long as they pass. So really, kidney disease is really what is really important, really big problem with the kidneys, and that's one of the leading causes of death in the United States.
Wow. What is kidney disease?
So there's a couple of different kinds, but the one we think about most often is something we call chronic kidney disease, or CKD for short. And what that is it's a gradual loss of kidney function over a long period of time. And when the kidneys stop working correctly, what happens is they can't filter that blood as well. And so what happens is all that waste and excess fluid starts to build up in your body, and that can make people extremely sick.
How common is that?
So unfortunately, CKD is very common in America. About 1 in 7 adults has some form of CKD. And the good thing is we can detect it very early, and there are a lot of treatments that we can provide that will really prevent it from progressing and prevent a lot of those serious health complications, which are really things like heart disease and ultimately kidney failure.
1 in 7 is pretty serious. What causes that chronic kidney disease?
Well, the two absolutely most common causes are high blood pressure and diabetes. And as you know, a whole bunch of people have those two conditions, which, they account for about 75% of the cases of CKD. So that's why it is so prevalent. Both of those conditions, the high blood pressure and the diabetes, actually cause direct damage to your kidneys. And then it makes it harder to remove all of that waste from your blood. So that's why it's so important. If you do have high blood pressure or diabetes, you want to make sure you're talking to your doctor. They're going to screen you for chronic kidney disease, absolutely. And it's a pretty easy test. You just check some blood and some urine, and you look at a ratio between the two, and that will tell you what your kidney function is. And then your doctor can help you with treatment.
So we got high blood pressure and diabetes. Are there other causes of chronic kidney disease?
Yeah, there are. Those aren't the only two. So we see a couple of less common things that can cause CKD. Kidney cancers, which are, thank goodness, relatively rare, but they can lead to kidney filtering problems. I mentioned kidney stones before, so people who don't get their kidney stones treated or they have real frequent stones that block that filtration system, that can cause some problems. And then infections as well. So people that have real frequent urinary tract or even upper kidney infections can go on to develop chronic kidney disease. And then a little bit more rare are some autoimmune diseases. The one most people know about is something called lupus, which can actually have chronic kidney disease associated with it as well.
Are there major risk factors for chronic kidney disease?
Yeah, absolutely. And really age is the biggest risk factor. So, as we get older, as with a lot of things, the kidney function naturally declines. It's just a normal part of aging. And the problem is that a lot of older people have those conditions, diabetes and high blood pressure. They're much more common in older adults, and so that's why we see an increased risk as you get older. And the other one to keep in mind, too, and talk to your family about this, if you've got a mom, dad, brother, or sister with kidney disease, you're much more likely to develop it as well. It does run in families. And then there are a few conditions, usually congenital conditions. Maybe someone is missing one of their kidneys or they've got an abnormal structure to the kidney. They can develop problems as they get older. And then one to not forget is smoking cigarettes. Cigarettes actually have a direct bad effect on the kidneys as well and can lead to kidney disease.
Symptoms of chronic kidney disease, how would we know if we're getting it or have it?
Yeah, so we see a lot of different things, and they can sometimes be subtle. Skin changes can occur. A lot of people with kidney disease have dry and itchy skin, some flaking. Some people can urinate more than usual, or they may urinate less than usual, so it's really a change in your urination habit. And then, interestingly, if you see foamy or bubbly urine when you go to the bathroom, that can actually be a sign of kidney damage. That's actually protein that's in your urine. And because you're not clearing all the fluid that you need to on a daily basis, you may develop some swelling. And particularly it's going to be in your hands and feet, kind of the dependent areas of the body. And then as it advances, we see people develop fatigue and weakness and sometimes even loss of appetite. But the important thing to remember is chronic kidney disease usually develops very slowly, and so the symptoms can kind of creep up on you. There may be no symptoms at the beginning. You can actually develop a fair amount of kidney disease before you really feel sick at all. So that's why you want to talk to your doctor, get your regular checkup so they can check you for CKD, because that early detection is really what you need to prevent ultimate kidney failure and all these other complications that can happen.
Well, from what I heard, I don't want it. I don't think anybody wants that. We want to stay away from that. When we come back, we'll talk about how to keep our kidneys healthy. We're talking to Dr. Brent Wallis, Dr. B, Chief Medical Officer at People's Health. March, it's National Kidney Month. Those little organs do a lot of work, and I think we take them for granted. 821 traffic now, WWL. 826 and a half, Tommy Tucker, WWL. It's National Kidney Month. We're talking to Dr. B, Dr. Brent Wallis, Chief Medical Officer at People's Health. If you download the Odyssey app, use the rewind feature, you'll be able to go back and listen to the first half of this about how important your kidneys are, or you can always wait till the audio is posted at WWL.com. Now, Dr. B, we move on to keeping our kidneys healthy because we don't want chronic kidney disease.
Absolutely.
So how do we do it?
you don't think about your kidneys, right? And if everything's running smoothly, it's nothing to worry about. But the piece I want people to take away from this is that it really is possible to have kidney damage early, especially if you've got some of those conditions that I was talking about, and you may have no symptoms at all. So you want to make sure you take care of your kidneys so you don't develop these problems in the future. And one of the best ways you can do that and really help a lot of other chronic diseases is by eating healthy. And it's the same diet we talk about all the time. Whole grains, fruits and vegetables, low-fat dairy products, and those lean proteins like beans, nuts, and salmon. You really want to avoid foods that are high in salt because that makes your kidneys work harder, and anything with saturated fats can clog up those little filters and make them not work as well. So diet really is important.
Seems like always comes down to the same stuff. How else can we protect our kidneys?
Yeah, so if you do have high blood pressure or diabetes, you want to make sure that you talk with your doctor. They're going to educate you on all of the potential things that can happen. Those are the two most common causes of CKD, and you want to make sure that whatever medications your doctor's giving you, what other instructions they're giving you, that you really do follow. And then you want to, avoid things that directly harm your kidneys as well. Too much alcohol can be very bad for your kidneys, so you want to limit your alcohol intake. I mentioned that smoking directly affects your kidneys as well, so talk to your doctor about quitting and find a way to quit. And then really important, too, is stay hydrated. This is so important here in Louisiana, especially when it gets hotter. Any dehydration can cause damage to your kidneys. So making sure you're drinking plenty of water and not just, sugary drinks and stuff like that. You really need water to help filter all that stuff out of your body.
One question, if I might throw it in while we have a minute or two left. When it comes to dialysis, when people get on dialysis, do you ever get off of it?
Yeah, very rarely. The only instance usually you can get off of dialysis is if you have a kidney transplant. And believe me, if you've talked to anyone on dialysis, it is not something you ever want to go through. So that's why this is so important. Keep your kidneys as healthy as you can.
And what is dialysis, doctor?
It's basically an external way to filter the blood. So it's replacing that function of the kidneys but outside of your body. And it requires a lot of heavy equipment, and often you have to go somewhere to get it done as well. So it's very inconvenient, can be painful, and people don't feel good when they're on dialysis.
Stay away from that. Keep your kidneys healthy. Thank you, Dr. B. Appreciate your time. Have a good week.
Thanks, Tommy. You too.
If y'all want to find out more about People's Health, all you have to do is go to peopleshealth.com, or you can call them at 1-800-978-9765. You can always meet with them in person at the People's Health Medicare Center. Nice facility in Metairie. It's at 3017 Vets, right next to Party City. We've been out there before. And they are hosting an educational presentation about chronic kidney disease at the Medicare Center tomorrow, Friday, March 15th at 10 a.m. So if you got concerned about what Dr. B was talking about, if maybe you're engaging in some of the high-risk behavior and it scared the hell out of you, good, because you want to keep your kidneys healthy. You certainly don't want to head toward dialysis. Take advantage of that educational presentation about chronic kidney disease at the Medicare Center tomorrow, Friday, March 15th at 10 o'clock, free and open to the community. So stop by to learn more. Again, you can always go to peopleshealth.com or call 1-800-978-9765. When we come back, we'll talk to Mike Detillier about Saints, free agency, and more. Right now, it's time for WWL First News.